David Clark.
Chair, well, thank you for the opportunity to speak at this committee stage. I, of course, will be speaking in support of the bill, as my colleagues have, and in support of the amendment put forward by the Honourable Annette King, which does give an opportunity to the government to step up to the plate, to restore democracy earlier if there is sufficient progress made by the commissioners on those issues which have really been concerning people in the south and across New Zealand, I think, in respect of the Southern District Health Board, as it wrestles with ongoing financial difficulties and ongoing issues of capacity. And I think it's helpful for the House to remember, of course, that part of the loss of capacity was due to people leaving when there was a great deal of uncertainty about Health Benefits Limited and what it would achieve, and the centralisation of financial structures across New Zealand in what turned out to be a failed project. We know that people left Dunedin to be a part of that failed project, and so the Southern District Health Board actually bled capacity. It bled planning capacity and financial capacity around that time because of a failed experiment by this government. Now, before the commissioners were put in place, we know that the government had a Crown Monitor on the board. We know that for 6 years it had that Crown Monitor and who acts as a government watchdog effectively on what is going on. A direct line, if you will, to the Minister to ensure that a board is performing its duties effectively and doing what is asked of it. Of course, the Minister also chooses the chairman in a normally run board and 5 of the 12 board members. So the Minister and his predecessors have to take responsibility for the situation that the Southern District Health Board found itself in. Of course, then the Minister, and we have supported this, stepped in and said, we will appoint a commissioner. We are not happy with the progress, and of course we must own the lack of progress in the Southern District Health Board in meeting its financial targets and also in meeting the expectations of New Zealanders for delivery of health care. The buildings have become run down. We are familiar with the fact that there is a major asbestos issue in the buildings in Dunedin, and we've become aware, of course, of lower staffing levels and of various attempts to work with limited finances. And the Honourable Annette King also referred to the funding model and the review that the Minister undertook. And we on this side of the House are not convinced that funding review was sufficiently broad and sufficiently deep to really assess whether the DHBs are being funded fairly. And the very example the Honourable Annette King just used of the rural adjuster and the fact that South Canterbury actually receives more funding per capita for rural populations despite having a far smaller geographic area, when the Southern District Health Board covers a geographic area the size of Belgium. It just doesn't seem right. There are questions around whether the tertiary funding area in terms of training is adequately compensated, and so on. And those questions were not probed in that review in sufficient depth. In speaking to the SOP put forward by the Honourable Annette King, I want to say that if the Minister does take up that challenge, I will be impressed. I'll put that on record in advance. It is a way that the Minister can show that he is committed to the restoration of democracy there, which rightly has been raised as a concern because of the government's track record with ECAN and elsewhere, and that sense that the government seems increasingly out of touch with Middle New Zealand, that sense that they are not genuinely concerned in democracy and in what Middle New Zealand thinks about issues and would like to see happening in the country. But if that is going to be the case, then I think we want to see a number of areas of progress before the intent of that SOP is realised through an order in council. And the kinds of things we would like to see, of course, things like the finances coming under control for the DHB, that consistent deficit either disappearing immediately or a clear plan as to how that is going to be diminished. We would like to see some clear and measurable signs that structure and capacity is there to deliver the healthcare in Otago that we would expect that all New Zealanders would, could and should, Mr Chair,
David Clark.
would, could and should expect of their DHB. That capacity is there at a planning level as we see the new hospital being planned for Dunedin, and also at a governance level, that there is within the management structure the ability to report to governance effectively, and also some confidence about the people the government intends to appoint for its appointments in that process. And I guess the other key indicator in that area would be a credible plan for the rebuild, because that is something that Southerners have been crying out for some time. Capital on the table, a date at which construction will begin. And I actually have a petition running in the South that seeks a commitment by the government to begin construction by 2017 on a hospital rebuild. The previous minister expected, while he was still minister, for there to be a business case to Cabinet for that rebuild. Now, all we have seen since then is duck shoving. The timelines have been pushed out. They have been pushed out further and further and further. It is like this government is simply not committed to that hospital rebuild. It's like they want to push it on to some future government and pretend the issue is not there. Well, actually, it is incredibly important for New Zealanders, and particularly New Zealanders in the South Island who access those services, that we have money committed, that we have capital committed to that project, and with it, a start date for that physical rebuild, because that is what really shows true commitment. Also, we would seek from the Minister an assurance that the same tertiary level of hospital will be retained, so that services will not be lost to people in the South. Healthcare needs will change. Ways of delivering services will change. Let's have a mature debate about this. But we seek an assurance that the same tertiary level of hospital will be maintained by the Minister, because we should not see falling levels of healthcare in New Zealand. In the meantime, we want to see, and it was expressed in the Select Committee process, a commitment to increased reporting. And there have been some moves made by the Commissioners since that Select Committee debate to have more transparency in their discussions, to invite people to some of the sessions that the Commissioners are running, have some more open discussion, more like what there was when the board was in place. Locally, I have certainly had feedback from people concerned that Labor hasn't just outright opposed this. We have taken a response that we believe is the right response, to support the Minister's desire to get stuck in, to make a difference here, and to have commissioners who sort out the financial difficulties and the planning difficulties and the capacity difficulties at the hospital, commissioners who will commit to the rebuild, to the nature of the rebuild and the timeframes, and we want to see the government committed to that. That means that the Minister has even closer responsibility than he used to. Let's acknowledge he used to appoint the board members. He used to appoint the chair. He had a Crown Monitor on there. He now has his own commissioners reporting to him. We want to see the Minister commit to those timelines, to commit to the financial health of the DHB being restored, and to commit to funding it adequately. These are the commitments we seek from the Minister. If he does not achieve these things, he will have failed. He is directly tied to the appointment of those commissioners. He has skin in the game, and the Southerners want to see this government delivering. It is Dunedin's turn. Dunedin is the last major metropolitan hospital in the country to have a rebuild, and it is simply unacceptable that the timeframes for that rebuild continue to get pushed out, and that Southerners get lesser health care than people elsewhere in the country, and less than any New Zealander should expect. Most New Zealanders are pretty reasonable. Most New Zealanders simply want adequate level of health care. They want to know that the hospital will be there in their time of need, and that the government will be funding it adequately, rather than a $1.7 billion shortfall that we have seen under this government. As I said at the outset, Mr Chair, we will be supporting this bill. We do think that the Minister has the responsibility to step up with this support to deliver on the promises of the government, to adequately fund healthcare and to drive forward the hospital rebuild and the governance and management arrangements at the Southern DHB.
Kevin Haig.